Dr. B, pediatric neuropsychologist.
And I'm Catherine Mukes, licensed professional counselor. And welcome to
Let's Talk.
So today, Dr. B and I want to come at you with some things that we've been hearing people say about counseling and therapy and psychologists and how come they're not planning on coming. And so one of the first myths that I've heard recently, Dr. B, is that, and I think this isn't one that I've heard recently, I've heard this for a long time, is that if I go into counseling, that means I'm crazy, something's wrong with me. What do you make of that?
Wow. Yeah, I've definitely heard that as well. People seek therapy, counseling for many different reasons. And sometimes people are seeking just support.
Absolutely.
Sometimes we just need some extra support to have someone who can offer an objective viewpoint, someone who's not so directly connected to our situation, someone to just help us manage daily life, daily stressors, and organize things in our life. People go to see therapists for various reasons, and it does not mean that you are crazy or have some type of specific mental health disorder. Now, people also do seek therapists for more serious psychological disorders, but the range for which a person is seeking treatment or the reasons for why they're seeking treatment can differ, and it certainly doesn't have to mean that you're crazy.
Absolutely. And and it's one of those things, if you say even someone with a severe psychological disorder that's happening right now, you're crazy, that's crazy. I would like to put it like this. If any one person who goes into therapy or to counseling or to see a psychologist is crazy, then we're all pretty crazy. Because anyone, like Dr. B said, for any reason can go and seek out professional counseling, seek the assistance of a psychologist, a psychiatrist, or any other mental health professional.
One way I like to think about it is kind of relating it to the medical profession. If we have a cold, we may think that's not too serious, but we might go and see a physician about it.
To make sure that it's not something more serious, that it's not pneumonia or the flu or something like that.
Exactly. And it works the same way with mental health. If I'm, having some concerns about my emotional behavioral functioning, maybe it's, something, a daily stressor or just a life transition, and I'm having some difficulty adjusting, or maybe it can mean something more serious for me, but I'm going to go to a mental health provider to make sure that I'm getting that evaluated appropriately.
Absolutely. Want to get that checked out. So, myth number one, that's a lie. If Maury was here with his lie detector, he would determine that is a lie. All right. So here's another one. One of the things that I've heard people say is that I'm not going to therapy because that costs too much. Only rich people can afford that.
Well, some ways to think about therapy is there are different types of assistance that you can get to help alleviate the costs that may be associated with therapy. For example, insurance companies often cover some portion of the cost of mental health. Mental health care.
Absolutely.
But we also have to think about what's the benefit here. Is it worth, me having to go and talk to someone? Is it worth my mental health and my emotional and kind of behavioral functioning? To what degree is it important to you that you're functioning in a healthy way, in that aspect?
Because we'll spend money on things that are important to us, right? I mean, pull out your cell phone. Okay, so many people are spending right now $600, $700, $800 on a phone that they'll replace in 2 years. Well, your mental health, once you get your mental health in order, that's something that you get to take with you for a lifetime. And so it's really about thinking about what the benefit over the cost is. And for some, there may be certain types of professionals that may be more to your leaning, depending on again, if there's insurance involved. So if you want to use your insurance to help alleviate some of those costs, that may be available to you. If you truly can't afford to seek mental health assistance, there's numbers of programs and community agencies in many necks of the woods that will allow you to, for low or no cost, depending on your range of income, to be able to get those needed services. But the bottom line of it is, from a cost benefits perspective, the cost is virtually minimal compared to the lifelong benefits of seeking good professional treatment for whatever it is that ails you.
Absolutely. Another myth, so we've talked about, therapy costing too much and have debunked that myth. Another myth that has come up for us is the idea that therapy is a lifelong intervention. And we want to debunk that, because some people can benefit from long-term therapeutic intervention, and the level or severity of their mental health concerns may warrant that. But that is not the case for everyone.
Absolutely.
Some people benefit from very short-term focused interventions that address a specific behavior, specific concern. Some people benefit from intermittently visiting with their therapist, and it really does depend on your goals, the specific mental health challenge that you may face, and you coming together and making a plan with your therapist, and you all being on the same page about that, and what it's going to, what you will all expect, how many sessions and things like that it will take for you to reach those goals.
Absolutely. Because I know we see a lot of things in the movies and things like that where people have been seeing their therapist for 30, 40 years. And, as much as we love you, we don't want to see you that long, but just really thinking about what it is, what are you there for? And sometimes one of the reasons that we may end up in treatment a little bit longer than what we thought is because what we thought was the problem before we find out along the way it's not really the problem, and so we have to switch gears in the middle. But really being able to understand that it doesn't. There's all different types of treatment. So for example, Dr. B, you do a lot of assessment. So Dr. B may see you 2 times and she's done with you.
Yeah. That's true. That's very true.
You have some therapists who maybe focus on what they call solution-focused therapy, where kind of like you mentioned, there's a specific thing, there's a specific goal. 6 to 8 times, we're wrapping it up. And then you may have some more of the psychodynamic therapists that we are going to go all through your childhood experiences and all the way up and through to today and how that affects you and whatnot. But really understanding what may be the modality of the type of professional that you are. Or with medication, we always try not to forget about my psychiatrist friends, is that some medications you may have to be on for the rest of your lives. Some of them you may not have to. You think about it like you wouldn't say to somebody, oh, don't go see your doctor because you got diabetes. They're going to just put you on medicine. Well, you're going to go and you're going to take the medicine. And in the meantime, if they say, hey, here's some things and some tools to help you to get off of the medication or to reduce the medication, then you start to implement those things. But if you don't implement those things, you may end up being on that medication for a lifetime. So the same way with our physical health, our mental health, we want to take the same steps with that.
Absolutely. So I think we've debunked that myth.
Yes.
Therapy does not have to be
for the rest of
your life. One thing I want to circle back around to is this idea that we discussed regarding insurance and the way that insurance can provide assistance in mental health cost. I've heard individuals say that they are concerned about using their insurance, particularly if it's provided through their job, because they're concerned that somehow the information or the diagnosis that's provided to insurance will get back to their job and potentially lead to some type of discrimination or judgment.
Yeah, and people do get scared because there's such a stigma around mental health. But one of the things that you need to know is that when it comes to mental health practices, all of the mental health providers are bound by code of ethics, and a big part of that code of ethics includes confidentiality. And what that basically means is that, with few exceptions, things that we discuss in the therapeutic room remain there in the therapeutic room. And so you don't have to worry about information getting back to your job, getting back to other things like that. Sometimes where that may be a time, for example, if you are mandated by your job because of performance issues or something of that nature, to go and see a professional. And a lot of companies use what they call employee assistance programs, and they'll connect you with someone, and that you would go through some coaching and some talking about what's going on. And the information that would be reported back in those cases would be the fact that you actually came to those sessions. And so the details or the content of what goes on in the therapy room, again, it's pretty sacred. It stays right there between you and your provider. The only other time that any information like that would be released is if there's evidence of child or elder abuse, because as mandated reporters, we're sworn to protect those who can't maybe protect themselves. When it comes to insurance, of course, there's some things that insurance would need to know. So, for example, because our medical models are primarily set up for treatment of diseases, there would have to be some sort of diagnosis assigned and reported to the insurance provider using a specific code, so that your provider can be reimbursed for that counseling or that therapy or that testing that they did on your behalf. And that's kind of generally speaking. There's some times when that's not needed. So, for example, if you have an employee assistance program, diagnoses aren't required for those. And so it's really about understanding your insurance and those different types of things. And I know we talked a little bit off video about the idea that there may be some high clearance required jobs that may go back into your medical file for different things. And of course that's way above my pay grade. So being able to understand what will be required and how much information. And of course, a lot of those things will come with a consent or release from you. So that's you going in and signing and saying, hey, it's okay that you share my diagnosis, or it's okay that you say how long I was in treatment, or it's okay that you release my medical records, or no, I don't want you to release anything. You can just send them a letter that said that I came from this date to that date, and that's all they need to know. And so you are in control, along with HIPAA. It really cuts back on what types of things people can release about your health, your mental health, or any of your health without your consent and your information.
Mm-hmm. So it sounds like, this myth about my job will know my diagnosis has been debunked right here, right now. It sounds like there are very limited situations in which a mental health provider would have to release that type of information, but that there are few and far and in between when those circumstances would happen. And it sounds like there are some laws that are set in place to protect us.
To protect you, absolutely.
And protect our, sensitive health information.
Absolutely.
And that includes, like we're saying, mental health information as well.
Absolutely. So today we have debunked that being in therapy makes you crazy. We have debunked that it costs too much. We have debunked that you have to be in this thing for the rest of your life. And we have also debunked that your job will know about your mental health status.
So we hope that you all will be able to benefit from some of the things that we've discussed today. Please share them with family, with friends, like this video, comment on the video, and most importantly, share the video with the world.
Yes, let people, you never know who can use this information. And if it was helpful for you, we definitely hope that it will be helpful for someone else. So until next time, take care.
Bye.